Good afternoon, and welcome to this Johns Hopkins Congressional briefing on food insecurity. I'm Lainie Rutkow, Vice Provost for Interdisciplinary Initiatives at Johns Hopkins University, and I'll be moderating today's briefing. For the past 3 years, COVID-19 has afflicted all segments of societies around the world with social upheaval, severe illness, and death. But only lower income populations have endured the suffering of an additional consequence, severe food insecurity. Hunger, famine, and food shortages were already escalating before the pandemic. Now the issues have been spiraling towards unprecedented levels due to multiple factors. The pandemic severely disrupted agricultural production and supply chains, and caused massive job losses that slashed incomes for millions who were already feeding their families paycheck to paycheck. At the same time, extreme climate-related events, such as historic droughts and floods, has significantly diminished food supplies. In addition, Russia's invasion of Ukraine, one of the world's largest breadbaskets, has turned an already dire situation into a looming catastrophe that could tip the global economy into a recession that would only accelerate the food crisis. The 2022 Global Report on Food Crises, released last month by the Food Security Information Network, estimated that 205 million people now face acute food insecurity and require urgent humanitarian assistance. It is the fourth consecutive year of rising levels of food insecurity and represents a 52% increase from the 135 million estimated just 2 years ago. Citing the network's respected global analysis, the US State Department late last month released its Food Security Action Report, which details how the nation is addressing what the agency called emergency levels of acute food insecurity just one step away from famine. In addition, the Biden-Harris administration released in September its national strategy on hunger, nutrition, and health, with a goal of ending hunger and increasing healthy eating and physical activity by 2030 to help reduce diet-related diseases and health disparities. Sadly, as is typical, all these forces are affecting the nations and communities least equipped to mount effective responses. Only a concerted global effort, led by nations with the most abundant resources, can begin to address these crises before the worst outcomes begin to unfold and further destabilize the world economy. Those outcomes include lower academic achievement among children, diminished workforce productivity, higher healthcare costs, and other societal implications. I'm grateful to the 4 experts taking part in today's briefing to help us explain this urgent situation and to explore possible solutions. Joining us today are Jess Fanzo, Bloomberg Distinguished Professor of Global Food Policy and Ethics at the Berman Institute of Bioethics, the Bloomberg School of Public Health, and the School of Advanced International Studies. She is Director of the Global Food Policy and Ethics Program at Johns Hopkins and is Director of Food and Nutrition Safety at the Johns Hopkins Alliance for a Healthier World. Her most recent book, Can Fixing Dinner Fix the Planet, was published in 2021, and from 2017 to 2019, Fanzo served as co-chair of the Global Nutrition Report and the United Nations High-Level Panel of Experts on Food Systems and Nutrition. Laura Samuel is an assistant professor at the Johns Hopkins School of Nursing. Building on her prior career as a family nurse practitioner, her research explores the many ways in which income inequality translates into health disparities and how a lack of financial resources can be detrimental to health. Her research has shown how better access to food and housing can improve health outcomes for low-income families. Roni Neff is an associate professor at the Bloomberg School of Public Health and the Center for a Livable Future. She researches wasted food, urban food system resilience and food worker issues through the lenses of public health and equity. Building on prior work with Baltimore City and in collaboration with cities around the country, Neff's team is developing tools to help local governments strengthen the resiliency of their food systems against climate change and other threats. Parul is a professor and director in the Bloomberg School of Public Health's program in human nutrition. She studies how to improve maternal and child nutrition with effective solutions in low-income settings. Her research has shown how maternal nutrition and health can decline as dietary intake related to food insecurity worsens, and how improving nutrition during pregnancy can improve birth outcomes and maternal health. Before I turn to each of our panelists for their initial remarks, I want to remind our audience that we will be providing answers to your questions in real time today. So please submit questions for our experts in the box that you see at the bottom of your screen. When you do so, if possible, please share your organizational affiliation. We'll start with each panelist providing a brief overview of key topics, and then we'll move to Q&A. Jess, I'll turn to you first. Can you speak to just how dire the current food insecurity landscape is in the United States and around the world? And tell us, are things going to get worse before they get better?
Great. Well, thank you, Lainie, for inviting me to be a part of this very distinguished panel. The news is not great. We are dealing with significant climate disruption in the long tail of the COVID-19 pandemic, and they've weakened global economic, food, and health systems. And now with the Ukraine-Russia crisis, many view the current situation as having reached a tipping point. These three C's, climate, COVID, and conflict, are having significant impacts across 5 mediators, also known as the 5 F's: food, fertilizer, fuel, fodder, and finance. So the global food system is quite fragile and vulnerable to the impacts of the 3 C's and the 5 F's, but they all interact and they can amplify each other, having significant impacts on people, their health, diets, and the planet. When you look at the current global food security outlook and the Ukraine-Russia conflict, it's really become another crisis upon a range of crises the world is facing. So in response to the crisis in Russia's and Ukraine conflict, both being important and major breadbasket countries, FAO's International Food Price Index has increased, and it really peaked in mid-May 2022, all-time high peak of food prices. In the last few months, those prices have come down, but only to pre-war levels, which are still elevated due to the global economic downturn, the pandemic, and supply chain constraints across a variety of sectors. At the same time, fertilizer and energy prices have risen sharply, further generating food price increases and speculation. Much of that rise is due to Russia cutting off supplies of natural gas from pipelines to both Central and Western Europe, which have basically led to the halting of nitrogen-based fertilizer production. And of course, Russia and Belarus are major producers of potassium, another fertilizer component, which is really putting constraints on farmers. Farmers are hesitant to purchase fertilizer prices, changing planting and future harvest. So it's not just a short-term potential impact, but longer term. Extreme weather, climate-related events are also having significant impacts on yields of a range of crops, drought-like conditions impacting Argentina, maize harvests in the US and China and Europe, along with rice prices increasing, particularly due to the catastrophic floods in Pakistan being the 4th largest exporter of rice in the world, as well as India's recent restrictions on rice exports, is really exacerbating this whole effect. But it's not just food prices, it's really the impact of food inflation, food price inflation. It's alarmingly high around the world, including the United States, with increases up 20 to 30% since July. And food price inflation is what people actually pay for in their country domestically. Many low and middle income countries are really reeling from these food inflation, particularly low income food deficit countries like Zimbabwe, Lebanon, Venezuela. They're seeing massive food inflation, over 30%. And even before the Ukraine-Russia conflict, we've made a lot of progress on undernutrition and hunger, but that's really changed over the last few years, like you had said, Lainie. The COVID pandemic has made things worse, along with climate events, civil wars, are starting to reverse the progress made on undernutrition and hunger and reversing the trends. And I hope Parul talks more about this, but we've seen more children susceptible to wasting, more children chronically undernourished or stunting, and more people who are going to bed hungry. So these statistics, after decades of slow decline, are now rising and rising rapidly. And that is really debilitating for countries to be going through. Now, where we're at now on the acute side, 45 countries, including 33 in Africa, 9 in Asia, 2 in Latin America, and 1 in Europe, being Ukraine, need external assistance for food. We've gone from acute food insecurity of 155 million people in 2020 to now 223 million people in need of food assistance, with places like Afghanistan, Ethiopia going through their own conflict, Nigeria, South Sudan, Somalia, Yemen, all having populations that could potentially face starvation if we don't act now. Let me just end with, I think we are in a situation where we need significant social protection. I'm happy to talk about that. But we need to be also thinking long-term of how do we insulate and protect vulnerable populations from some of the worst impacts. Well, one is through climate. The Convention of Parties, also known as COP, is meeting in Egypt in 2 weeks. And while food has been represented mainly in side events, a bit on the sidelines, it's been essentially left off the agenda. It's never written into the text and negotiations of the COP meetings. This is slightly insane at this stage, being that food systems contribute about 30% of total greenhouse gas emissions. So I hope over the next 2 weeks, food is put on the agenda, both the mitigation and adaptation of climate change through food systems, and that world leaders step up. And this means that the US food system should be on the agenda, but also our relations with other countries and the multilateral cooperation that ensures that our world order is resilient remains very central to the COP meetings. Thank you so much.
Thanks, Jess. Laura, I'll now turn to you. Can you explain how socioeconomic factors drive food insecurity and how that may be exacerbating health disparities that were also deepened by COVID-19's disproportionate impact on minority communities?
Thank you, Lainie. It's a great question. And really also want to thank the organizers and everyone for joining this important discussion today. And I'm going to focus my comments on kind of 3 key points. And most of my work is based in the US and based on financial strain. So you'll hear a lot of that coming through. And so the first key point is that food insecurity is really an under-recognized public health problem, right? So we know even before the pandemic, in the US, for example, about 10% of US households were food insecure. And I think Lainie highlighted the many health outcomes that can occur as part of that, really across the lifespan, from childhood through chronic conditions in midlife, and as well as disability in later life, which can be a risk factor for costly nursing home admissions. So we really want to try to prevent those health consequences as early as possible. But one of the challenges is that food insecurity often goes undetected, right? And so in my life as a nurse practitioner and based on the research I've done, I can tell you that people experiencing financial challenges universally tell us that it's stigmatizing. And so we really need to be asking the right questions. We need to implement broader universal screening for food insecurity. And there are well-validated short tools, 2-question tools that are out there that could be more widely used in healthcare settings and public health agencies and social service agencies and the like. And so I think one key point then is just kind of broadly recognizing this as a health problem. And then I think the second key point that I want to make is that food insecurity is really driven by financial strain and that there are vast disparities in it. Financial strain doesn't just capture a person's actual income level or their poverty level, but it really captures whether someone's income is sufficient for their specific household's cost of living. And we know that cost of living can vary dramatically, right? Not just based on regional cost of living, but based on rising housing costs or rising healthcare costs, childcare costs, and the like. And so 2 households with the same income level may have very different levels of food insecurity and financial strain. And it's not limited just to people who are living in poverty. And a lot of people tell us that financial strain is, they kind of describe it like a balancing act of trying to always make ends meet, right? And so they finagle their finances from one month to the next. Sometimes they may experience food insecurity, but at other times they may experience housing insecurity, or they may forego needed healthcare or prescriptions. And so I think what that tells us then is that we need to be doing a better job of really kind of perhaps identifying the root causes of food insecurity and addressing financial strain more broadly, but also providing wraparound services and not just referring people to food assistance, but perhaps also addressing housing or other high costs that people have. And because of income inequity in our country and structural factors related to racism and ableism, there are vast disparities. So, for example, people living at or near the poverty limit have food insecurity rates that are about triple that of the general population. People who are Black, Hispanic, or Native American have food insecurity rates that are double that of the general population. And people living with a disability have food insecurity rates, again, that are about triple that of the general population. So there are certain groups who are particularly and disproportionately affected who would benefit from greater outreach and assistance. And I think it's important also to keep in mind with regard to these disparities that they certainly preceded the pandemic, but the pandemic presented new and different challenges for many households. Research that I've done and other people have done have clearly shown that the people who, as Lainie said, were least able to handle a new challenge, they already had faced a lot of adversity. Those were the very people who are most likely to experience financial challenges during the pandemic, and that these challenges are not just the same old things they'd had before, but likely a new and different thing that kind of independently works in their life to kind of accumulate all of the challenges together and affected their health. So the third point I want to say is a picture of hope, perhaps, that food security can be addressed in meaningful ways. I think others on this panel are better equipped to talk about the food systems issues that should be addressed. Some of my research focuses more on food assistance programs, and I can tell you that they play a critical role in the U.S. and other places. The SNAP program, for example, has been shown to reduce food insecurity by 30% in low-income households. And there's good evidence that WIC and the pandemic EBT program, for example, also have been very critical for many households with children. And I think that this is a really critical conversation to have right now. We need to have more data-driven policies. There's also a large evidence base, not just before the pandemic, but especially during the pandemic, when many of these programs were expanded or changed in meaningful ways. And we should be looking at kind of what impact those had, so we can leverage that information as we make policy discussions. And I think there will be a lot of policy discussions in the coming year, because in the US, the Farm Bill will be renewed next year. That will prompt a lot of conversation about the food assistance programs that are funded through that funding. So I think this is a really timely conversation. Excited to be a part of it, and we'll turn it over to hear what others have to say. Thanks.
Thanks very much, Laura. And before I turn to our next panelist, I want to remind those who are watching that we are going to take questions in real time today. So please continue to submit your questions to us. And after we hear from all of our panelists, we will move into Q&A. Roni, how are US food systems holding up after all of the disruptions that we've mentioned already in this briefing? And what's being done to fix the challenges that we see? Roni, I think we don't have audio for you.
Hi, thank you. Got it now. So my comments focus on food system resilience, particularly at the community level in the US. And I'll focus on the need for 1, proactive planning, and 2, root cause solutions. And when I say resilience, I mean the capacity of a food system to provide food to all in the face of all kinds of disasters, short-term shocks, longer-term stresses. And so back to your question about how our system's holding up and what we can do to improve resilience. So our US food security numbers tell one important story. In March to April 2020, we had over 21% of US households reporting food insecurity, according to the Urban Institute, which points to the system's fragility. And we all became aware, far more aware during the pandemic, of how our food systems are undermined by structural inequities, racism, a lack of coordination and planning, far too much burden on workers, corporate concentration, and a set of incentives that push businesses and others in unhealthy and unsustainable directions, contributing to that fragility. But I want to also say that a year later, in the spring of 2021, the number of households with food insecurity had dropped by 6 percentage points in that same survey to 15%. And who would have expected that kind of recovery during the pandemic? And sometimes we think that these challenges are so big that nothing that we do matters. And this shift points to suggestive evidence of the impact that we can have with a strong response, as Laura was saying. And here's a partial list of what was done. A significant infusion of government financial assistance through multiple programs, direct provision of food through existing and new channels, key players in local food systems working together, building relationships, voluntarism, donations, and mutual aid, including millions of people showing up to support neighbors. We can't discount the amount of suffering that's wrapped up in having 15% of the population with food insecurity in 2021, but the robust response mattered. But here's the catch. By June 2022, that same survey found food insecurity rates were back to the 2020 level of above 21%. Why? All the reasons that Jess elaborated. And at the same time, some of these key supports to households have been removed. And so we have reason for tremendous concern about how all of this unfolds in the future, even in the US. So what can we do now? First, recognizing the recent success, we need to keep these safety net programs going to help families keep food on the table. If the US officially ends the COVID public health emergency, there's a risk of significant further loss of benefits, all at this time when we can ill afford it with food prices rising. But more broadly, with time to plan, we could be more strategic, more focused, and better prepared with sustainable solutions, many of which have co-benefits for other social goals. So we need to focus on root cause solutions that enable people to have economic security without relying on food assistance programs that can be fickle. And another piece of what's not happening, in addition to the climate change meetings that just mentioned, is we need to engage in focused planning with those most affected being fully included. Prior to the pandemic, food was largely absent from local emergency preparedness activities in the US. If food system resilience was discussed at all, it was in terms of improving agricultural resilience. That's critical also, but my focus here is on the community end of the supply chain, finding and affording food that meets our needs and preferences. and local governments have an essential role to play in food system preparedness and response and need to be enabled by federal supports. So local governments, along with the partners they engage, they know the local situation, the assets, the hazards, the vulnerabilities, the people, the organizations, the long-term needs and existing factors that can support or hinder response. They're well-positioned to monitor impacts and respond to them. They can connect local food system actors. Local policies contribute to shaping food environments and opportunities for improvement. Local governments can plan at community scale while connecting across geography and levels of government. Of course, in our globalized food system, we can't solve the problems all at the local level. We need a systems approach, including the entire food system with agriculture, everything. But without that local piece, it's hard to be successful. Some years ago, my team worked closely with Baltimore City, leading to this city being one of the first in the country to engage in food system resilience planning. Before that began, we and most other cities didn't even have someone with food expertise sitting in the Emergency Operations Center to help guide disaster response. Afterwards, we had concrete actions both for emergencies and longer-term strengthening of the system's resilience, plus connecting the different groups who need to be engaged. These activities helped position the city for a relatively robust response when the pandemic began. And recognizing the need and the rarity of such planning, my team and I wanted to support other local governments in doing such work. And so we convened a community of practice of 5 US cities to work together on developing a guidebook, which is now about to be published. It includes 6 core modules that walk planners through a process with tools and templates to assess their baseline functioning, critical assets, hazards, vulnerabilities, develop strategies, and implement, measure, all with equity emphasized throughout and a strong emphasis on community participation. In our baseline survey, more than half the participants said they didn't feel prepared to coordinate their city's response to an event that disrupts food access and availability. Now there's a strategy. In recent months, there's been tremendous US investments made emerging from a recognition that we need to do more to support our food systems. It's thrilling to see it all come together and hopeful. And they support many needs that are adjacent to resilience, but we need more focus on community-level food system resilience planning and root cause solutions. And local governments need the funds to enable the time and resources to do this work. As one community of practice participant said, "What I worry is that we're always in crisis mode and don't give any bandwidth to recovery and resilience. What needs to happen is we need to be thinking about what response, recovery, and resilience look like and start to put those things in place now. So we're starting to implement them in preparation for the next disaster." Thank you.
Thanks so much, Roni. Parul, I'll turn to you, our final panelist, and then we'll move to Q&A. The poorest nations have traditionally suffered far more from food insecurity and challenges in the global food supply, and mothers and children typically suffer most of all. How has the current state of affairs with food insecurity affected maternal and child nutrition, and what efforts do you think need to be prioritized?
Great. Thank you, Lainie, for inviting me to participate in this important discussion. First and foremost, I would like to emphasize that poor diet stemming from food insecurity is a leading cause of disease, disability, and death worldwide. In low and middle income countries, conditions arising out of dietary and nutritional deficits impact vulnerable groups such as women, adolescent girls, and children the most. Food insecurity leading to nutrition insecurity is very concerning, especially during the critical period of what is called the first 1,000 days of life. This includes the period of pregnancy and lactation and the first 2 years of postnatal life, a window of time during which nutrition and dietary insults can result in poor pregnancy health and adverse birth outcomes, leading to maternal and infant morbidity and mortality, poor child growth and development, and even lifelong poor health trajectories. Thus, maternal food insecurity during the critical periods of pregnancy and lactation can impact the next generation. With the rising food insecurity in low and middle income countries we are bound to see increased global burden of disease that will stay with us for a longer time. Very early on in the COVID context, a consortium called Standing Together for Nutrition estimated its impact on child malnutrition and mortality using a Hopkins-developed modeling tool called LiveSaved. Under a pessimistic scenario, which I'm using purposefully, they estimated that there would be 13.6 million additional wasted children, 3.6 million more stunted children, 283,000 more child deaths, and almost 5 million women with anemia as a result of COVID. There is concern that low birth weight, preterm birth, and other pregnancy-related adverse outcomes could also increase, but we don't have good estimates for these. One of the worries is that the gains in maternal and child nutrition of the past few decades could be reversed. FAO's 2022 State of Food Security and Nutrition report clearly dispels any lingering doubt that the world is moving backwards in its efforts to end hunger, food insecurity, and malnutrition. And we will be quite distant in reaching many of the SDG 2 targets for 2030. All of this, of course, calls for urgent action. There are some key evidence-based interventions that we need to consider. As we heard from earlier speakers in the US context, social protection and food assistance programs were used and effective in addressing the rising food insecurity situation following COVID. And such strategies could be applied in the LMIC context and targeted to households with women and children. Globally, in every region, the prevalence of food insecurity is higher in women than in men. In more hard-hit areas, direct nutrition support, including food supplements, may be needed. For women who are pregnant, the WHO recommends several nutritional services in the context of antenatal care, including supplementation with iron and folic acid or balanced energy and protein in undernourished settings. Prenatal multiple micronutrient supplements have been shown to reduce the risk of low birth weight in LMICs and are recommended for pregnant and lactating women in emergency contexts, and these should be scaled up. Efforts for treatment of severe acute malnutrition will need to be significantly ramped up, and special products such as the RUTFs made available in many hard-hit countries in sub-Saharan Africa and South Asia. The US government has shown great commitment to reducing international food insecurity, as described in the Food Security Action Report, which documents contributions for humanitarian assistance, including cash, food and nutrition supplies, health and nutrition programming, in-kind food aid, and in supporting key UN organizations such as the World Food Program and UNICEF, and the expansion of Feed the Future initiative. But even as Lainie, you were pointing at, bigger global effort is needed with multiple stakeholders and many more UN member states who have the resources. I'll end my comments now and look forward to the question and answer session. Thank you.
Thank you, Parul. And we do have lots of questions coming in. I want to encourage those who are watching, please continue to submit your questions and we will get to as many as we can over the next 25 minutes or so. Laura, the first question is for you. You mentioned the SNAP program in your opening remarks. Are there particular changes that you think would be helpful within the SNAP program relative to food insecurity?
Yeah, I love that question. I think there's many that could be done. I would direct people to some of the recommendations made in the Biden-Harris national strategy that was released recently. I think there's some data-driven modifications there, including better kind of integration of data and communication across systems so that people, for example, who've enrolled in one program and have already been documented to be eligible for SNAP might more easily complete the enrollment process. So there are many ways that we could kind of reduce the barriers to SNAP enrollment. It's a fairly cumbersome process, honestly. So that's one thing. I think another thing is kind of ensuring that people have the benefits that they need to really ensure that they can achieve food security. As I mentioned, financial strain is a key driver there, and the cost of living differs regionally. I think that the kind of benefit amounts that households households get may not be sufficient. There's still a large number of people on SNAP who remain food insecure. And so I think that kind of regionally accounting for cost of living or accounting for additional household expenses, might be another strategy to consider moving forward.
Thanks, Laura. Roni, several questions coming in about food waste. I'm going to give you the summary version. Can you talk us through the potential connections between food waste, mitigating food waste, and food insecurity?
Yeah, thanks for those questions. And it's an interesting and challenging question because the food that we waste, the food that's good quality that is discarded, much of that could be donated. At the same time, we don't want, in the words of my colleague, Tamara Soma, that people who are hungry should be our food waste infrastructure. We want to separate those issues. The root cause solution to food waste is prevention. The root cause solution to addressing food insecurity is enabling people to have the wherewithal to purchase their own food. But nonetheless, there is a lot of food out there, and it could be better used to we could have better systems in place to enable it to get to people in need, and to making sure that that food is high quality, good food that's being donated.
Thanks, Roni. And I'm going to stay with you for a piggyback question, and then Jess, I'm going to turn it over to you. So Roni, the first part of the question is, what do you see as some of the most promising strategies in the U.S. to address food waste? And Jess, could you pick it up and speak to the global perspective?
Yeah, there's so much ferment on this issue right now in the U.S. and so and globally. So I think that there's some really promising strategies in terms of waste bans, organic waste bans that keep food out of the landfill, and then that incentivize those who are having a lot of wasted food to find alternate solutions for it. I think that there's a lot of promising evidence related to taking a systems approach to prevention and really looking at the upstream factors that are leading to consumers to waste food, because so much of the food is being wasted at the consumer level. And that is a huge cost for households with lower incomes. And some of the ways that food is being wasted in these households are caused by systems that are that could be changed so that households have a better opportunity to avoid that waste and to have that food available to them.
Thanks, Roni. And Jess, over to you for the global picture on this one.
Yeah, I mean, Roni's the expert on food waste domestically and globally. I think a lot of what is being done in the U.S. on the retail and household areas of food waste relates globally in a lot of places. One of the big things that is impacting particularly the global South, for lack of a better term, is really around food loss. I mean, post and even before reaching the farm gate. And that's often due to poor storage, poor infrastructure, poor roads, which culminates into food loss. Also inadequate food preservation and processing capacity, particularly for the highly perishable, often nutrient-dense foods like fruits and veg and animal source foods. And that leads to significant inefficiencies along food supply chains, increasing the cost of healthy diets, creating more barriers for poor households. So there's a lot of effort right now on improving and minimizing food loss through better post-harvest storage, handling capacity, and technologies along supply chains, particularly in places that are infrastructure deficient. So that's sort of the next frontier as far as supply chains go in particularly rural places. And the USAID's investing significantly on trying to reduce food loss along with a lot of other of the G7 countries. So food loss is huge. So even in the United States, and Roni probably could speak to this as well, on farms and post farm gate, but I will quote one of Roni's papers, and I think everyone in the world uses this now. Food waste is nutrient waste, so it has big implications on people's diets and nutritional status as well. And I'm sure Parul could talk about that, but yeah.
So Roni and Parul, since you were both called out by Jess, do you want to weigh in before we move on to the next question?
No, I just wanted to echo what Jess said, and the context really from the low middle income countries is exactly what she described. And that is something that impacts even seasonal availability of food and causes spikes in nutritional deficiencies, wasting, malnutrition, micronutrient deficiencies, etc. So I think that solving for that food loss is definitely a very important area of work.
Thanks, Parul.
Two quick things.
Yeah, please do, Roni.
Just to highlight that there is a US and a global goal of having waste of food by 2030. And there's so much effort going on. And within the US, ReFed has put out a roadmap of food waste solutions that could get us towards that goal. And there's colleagues from a number of NGOs and the Harvard Food Law and Policy Project put out an excellent roadmap of policy solutions related to food waste that can be implemented into the Farm Bill and other places.
Thanks, Roni. I'm going to shift topics now, and Parul, I'm sending this question to you. So in your work, especially in developing countries, can you talk us through what you see as the connection between food insecurity and a more general public health crisis?
So yes, thanks for that question. I think the food insecurity situation in many low-income country contexts tends to be a chronic problem. And for example, in Bangladesh, where I've worked for the past 20 years, we find about 30% of households having household food insecurity of moderate to severe levels, and another 20% or so having mild food insecurity. So this exists as a common situation in rural populations living in South Asia, for example, or in parts of sub-Saharan Africa. I think the current context has exacerbated this, and this is becoming problematic. We've been trying to solve this problem of the impact of food insecurity to diets, and from diets to the well-being of mothers and children, especially, as I was saying, during the critical periods of time when fetal growth is to be promoted, when postnatal growth and development is happening rapidly. Those are the periods of time which are hit the hardest and most. And so we cannot afford to have such a crisis unfolding in these chronically underserved populations of the world.
Thanks, Parul. Laura, a question for you. In your work or in your clinical experience, have you seen a connection between food insecurity and medication insecurity?
For sure. Yeah. I mean, I think that's been very well documented, that there tends to be an overlap between those two things. And, certainly came up in qualitative research I've done where older adults talk about finagling their finances, as I said, each month to kind of scrimp maybe and not filling a medication as early as they should, versus, choosing to buy more groceries. So it is a daily struggle. I think, there's also a kind of overlap with housing insecurity, as I mentioned. So people are very often compromising basic necessities to try to make ends meet. And I think that we don't probably talk about that as much as we could. I think that's one of the challenges, is that we kind of think about this in a fairly like reductionist, almost silo kind of approach. It's like if you're a carpenter, everything's you have a hammer, everything's a nail. Some phrase, I forget. And so like we want to throw food assistance at things, but in reality, yes, people are complex and making daily decisions in terms of compromising things. And so we often see people making those very tough choices. And I think that's why it's so essential that we try to reach out and really understand the kind of the root causes, a broader understanding of financial strain, and then also kind of addressing the housing, healthcare, and food needs to make sure all of those basic necessities are met.
Thanks, Laura. Roni, question for you. What is the connection, if any, between urban farming or home gardening programs and food insecurity?
It's a good question. And so many of these programs are providing food to consumers, and it's often relatively healthy food, and it's being made available in areas where there may be relatively low healthy food access. And that's true in the domestic context and internationally. And in many international settings, in fact, that can provide a more significant component of the food supply for some households. And in some, in the US, I think, it's a solution that can be scaled more. But at the same time, households need more than what comes from there. They need their entire food supply. And so they need access to being able to afford food in regular food sources as well.
Thanks, Roni. Jess, question for you. From a global perspective, should we be more focused on food distribution or food production relative to addressing food insecurity?
Great question. Big debate among the food system actors. Short answer and more complex answer is both. Up to now, we produce enough food in aggregate at the global level. But that's going to change with climate if no action's taken. When you look at the climate models that have all over the last 40 years turned out to be true, if actually even worse than the scientists predicted. If you look at what they are called SSPs, or socioeconomic pathways, we are heading more towards an SSP3 to SSP4, which is not a great scenario. In the Paris Agreement, we're supposed to be more around 1 or 2, a more collaborative world order. In that business as usual, if we keep on this trajectory we're on now, climate change will exacerbate the ability for farmers to be able to grow food. Climate related and climate induced weather events like droughts and floods and other shocks, weather shocks, will make it increasingly difficult to produce enough food to feed 9 billion people. We're just about, if not, we've hit 8 billion. It's like this week or next week. And the quality of the food will decline. There's a lot of models suggesting that with more greenhouse gases in the atmosphere, like CO2, the nutritional quality, the nutritional content of certain crops will decline. So we're in a situation where food production, it will just be increasingly difficult to grow food in a very hot world, particularly in places that are already reeling from drought. And it'll be difficult to raise animals in a very hot world, particularly large beasts like cattle. At the same time, we are already dealing with inequitable distribution of food around the world, and everyone on the panel works in that space where a lot of people just cannot access enough food. In some places like the United States, a lot of people cannot afford a healthy diet. FAO's tracking that, and roughly 3.1 billion people cannot afford a healthy diet, which is insane, these statistics, and will likely get worse over the next couple of years. So I think it's both. We're going to need to ramp up production, and we're going to need to have better, more equitable distribution and ensure that everyone can access enough food and healthy and safe food. But I want to argue that it's a really good time with the fragility of the global food system and relying on a couple of countries that are considered breadbaskets, and that growing wheat, growing oils, and the calamities that have ensued from two countries going to war over and the commodities that have followed suit show that maybe we need to be diversifying our agriculture production systems. Relying on a handful of crops like wheat, rice, and maize has put us in a very precarious position, not only from a climate perspective, but also a nutrition perspective. So we need to start thinking about diversifying agriculture systems. And that, of course, is a complete reorientation of subsidy policies, trade policies. So the world is really at a reckoning right now of how do we really move away from some of these commodities that have put us in the constraints that we're in now.
Thanks, Jess. Laura, I'm going to send this next question to you, but Roni, you may want to weigh in as well. And it concerns provision of school lunch, and especially the uptick during the pandemic with more free school lunches being provided. Do we know anything about the connection between free school lunch and food insecurity?
Yeah, that's a great question. There has been several studies that have come out during the pandemic with the emergence of the pandemic EBT program. So that was a program that was intended to kind of provide food for households that include children who were eligible for free and reduced price lunches. So that tends to be less than about 185% of the poverty limit. So these are all low income households and communities. And yes is the short answer. There is evidence emerging now that pandemic EBT program made a difference in terms of improving health outcomes, reducing food insecurity in particular for those households. There's also some new evidence because there were more summer programs that have become available. There's always a kind of hunger gap in the summer for children. And so that gap has been started to be addressed in meaningful ways. And likewise, we're seeing, the Census Pulse survey, for example, which kind of tracks food insufficiency over time, has provided some evidence that those kind of programs and expansion of existing programs were really useful for those households.
Thanks, Laura. Roni, do you want to weigh in on this one?
Yeah, and so the pandemic EBT program also speaks to an issue that's been discussed for some time, to have universal school meals rather than like free and reduced lunch programs for some students and not for everybody. And some places like in Baltimore, we have universal school meals, and it improves outcomes and it reduces stigma, and it has a lot of benefits. And so this is something that's been discussed as a valuable direction for the future as we move out of the pandemic and as the pandemic EBT programs go away.
Thanks, Roni. And I'm going to start to wrap up, but I for our final question, I want to poll the panel. So I'm going to send this question to each of you, and Parul, it's going to come to you first. I hope that at least one of you will mention the upcoming expiration of the Farm Bill in your answer. So here's the question. If there were one thing that you could do to make progress in solving food insecurity, what would it be? Parul, to you first.
Let me kind of respond to your question by bringing up nutrition insecurity, which is the area that I really work in, which is really about making sure that diets are affordable, safe, and accessible to improve health in the larger community, but especially in women and children. And at least in the context that I work in, I think that the big levers of change are going to be these evidence-based interventions provided to women and children during the critical periods of growth and development that can make an impact. I don't think that this is this is solving the food systems issue, but it is important to consider complementary things that we can do to impact health outcomes ultimately. And I think those strategies are going to be needed in parallel to improving the food system. Thank you.
Thanks, Parul. Jess, same question to you. What single action do you think would make the most difference relative to solving food insecurity?
I think in relation to the Farm Bill, and it's probably the impossible ask, but it would be aligning agriculture subsidy programs towards commodities that support healthy diets like fruits and vegetables, nuts, legumes. And that would be a game changer for farmers who rely on those subsidies year in and year out. And a recent modeling study suggests that repurposing half of the global ag subsidies to support the production of foods that benefit both human and planetary health, we'd see significant improvements in a range of health outcomes as well as greenhouse gas emissions. So that would be my big ask. One that will likely not happen, but would be my hope that we really reorient agriculture subsidy policies, including, and most importantly, the United States, because they're such a big player in the global food system.
Thanks, Jess. Laura, same question to you.
Yeah, it's a great question. I think as it relates to the Farm Bill, I think that there are strong existing programs like SNAP and WIC and the pandemic EBT. And so building on the evidence base that we already have for them, I think there's good reason to provide even more support for those programs if we truly consider food insecurity to be a public health problem, to try to kind of prevent the adverse health consequences, which are costly for all of us and problematic with regard to health equity, and that there's a moral and practical imperative to act more using the existing policy levers that we already have and building on them with a strong evidence base.
Thanks, Laura. And Roni, sending the same question to you, and you will have the last word.
All right. Well, I want to say all those things. And food insecurity is such a multifaceted challenge, and there's so many things that are needed. There is no single silver bullet. So I really struggled with this question. And the answer that I come up with, if I have to choose one thing, is putting people who are directly affected by food insecurity in the room at every discussion, every decision that's made, and having that voice and that experience guide our decision making and guide our impetus to prioritize the issue more. And that's how we get to change.
Thanks, Roni. And with that, I'm going to wrap up with a big thank you to Jess Fanzo, Laura Samuel, Roni Neff, and Parul Christian for joining me today. I'd also like to thank everyone who attended this briefing, and especially those who submitted questions for our experts to answer. A recording of this event will be made available on this website, which is the online home of the Johns Hopkins Congressional Briefing Series. Thank you again for joining us.